Answer to the question, what is most effective in offender rehabilitation to the very end, but it's opportune that I bring it up now and reveal the secret. On the basis of some 50 years of examination of this problem, I've come to the absolute conclusion that the answer is to harness the potential of the offender as the basic reform agent. And this is best typified in probably the most successful drug rehabilitation organization in the world, Daytop Village in New York City. The basic idea there is that whoever enters the doors of the Daytop Village is given the assurance that by working with the program, he can, as though he were a patient entering a hospital, he's given the information that he can emerge as a doctor, that they will train him how to be a change agent in terms of newcomers to the organization. And with every passing day, I'm more and more convinced that basically the offender is very suspicious of what anybody who is not himself an offender has to tell him in terms of reward. And that's why I was so excited about what I heard from Nancy yesterday about what she was doing in a state prison to train individuals in reality therapy. I see my time is up. But I'll have more to say on this.
Thank you.
If you wanted to manufacture a criminal and assure that he would be beyond redemption, all you would have to do is to punish him to the extent that prisons do. Prisons make criminals. Every person that enters a prison leaves it a worse individual, more likely to be involved in crime than when he entered. So prisons are very much impossible as places for reformation, except TC stand for. Anybody have any idea? It's now part of the language, TC. Therapeutic community. And I feel almost that I'm impelled by a higher power when it comes to this, because just a week before coming here, I received a telephone call from friends in New York who said, go out at once and buy a copy of the Sunday Times. The Sunday Times, mind you, for an article about what has been one of your favorite topics. And here's the article. You see, you recognize magazine section of the Sunday Times. And under it is a picture of this felon, and it says, 6 years ago, a one-man crime wave named Bill Glidden went to prison. Now he's clean back on the street, finding out if drug rehab works. And what was the drug rehab system that was used in his prison? It was the establishment of a therapeutic community, meaning the prisoners were canvassed, and those that wanted to join this experiment were permitted to do so. Those that wanted not to join could stay where they want. Because you've got to recognize that there's a well-developed culture within prisons which says that any indication of a readiness to change, to reform, to cooperate means that you're a snitch, you're no good, you're not one of the boys. So the members of the TC are sort of outlawed as far as the total structure is concerned. The particular model is based not entirely after Daytop Village, but a opponent of Daytop Village, one of the contending therapeutic communities in the New York drug system. And according to this very vivid article, the man says, I'm a changed person. All my life I've been a criminal. I've engaged in the most heinous kind of offenses. Now I see things differently. All as a result of being a member of a small group, maybe 10 or 15 residents, prisoners, with a minimum of supervision from the outside. And I can tell you for a short time, we ran a TC in the FCI, Federal Correctional Institution, in Tallahassee. And the amount of enthusiasm about working together, that prisoners who are sympathetic to this idea, is hard to believe. And the amount of change that you see taking place before your eyes beats any other approach in terms of reformation that is known to man. So I suggest again, and therapeutic communities offer a very healthy approach, of course combined with reality therapy and control theory. Basic to Daytop Village And I used to run reality therapy courses there regularly with the residents. These are drug users to whom I would explain reality therapy. If you're going to work within a TC, if you use reality therapy, if you use some of the ideas of control theory, you'll be doing very much better. Life will be better for everyone. So I think we have possible some very solid advances towards offender rehabilitation. And I think this is a absolutely necessary response to the Martinson edict of about 15 years ago when he said nothing works. If we had time, I would tell you all about that very fascinating study. I'm very happy to see that there seems to be a change within criminology and within treatment, that perhaps offenders are possible subjects for rehabilitation. Right, Alex.